Virtua is a healthcare provider in what we call the greater Philadelphia suburbs in New Jersey, southern New Jersey. So we basically service the Tri-County marketplace just east of the city of Philadelphia. So if you, from a geographic perspective, you think of Atlantic City, New Jersey, and Philadelphia, we're in between those 2 points. When you consider high-need patients in our community, I mean, that can mean a lot of things, and both for the physical needs of patients and also for the mental, emotional needs of patients. So we're trying to deal with both of those things, and we did a community health needs assessment recently that is set with the counties, with our 3 counties, that health departments that worked with us and other hospitals in the region, and really assessed from the community's vantage point, what they think their needs are. Actually, behavioral health was #1 on that list, and that's where we started to work a little bit more on one of our campuses, developing it more into a behavioral health campus for children and for adults. So people with mental health issues or people with drug or alcohol issues, we can care for them properly, because what typically happens with those people is they enter an acute care hospital emergency room, they get admitted, and they could be there weeks, really not getting optimal care. So the goal is to put people in the right place for the right care, and that's what we're doing there. From a physical side, we're providing a lot more care at home to communities, people that are kind of in their houses and not receiving a proper level of care. So we're doing a lot of care coordination and things of that nature. And then in the inner city of Camden, how do we provide better outpatient service, primary care to patients? Chronic disease in the inner city and the underserved communities very high. So we're really looking at how we treat those needs of that community as well. Virtua has a primary care center in the city of Camden. And primary care is very important in the city because it's the entryway for care, and a lot of residents need primary care, and there's not enough access to it in the Camden inner city. So we've been there for years, but we found that we need more primary care, and we need to increase the size of our facility because the need's greater than we can support right now. So we're actually going to do a tear down of the existing center over time and build a brand new $22 million facility right in the Camden community that will service primary care, and it will also service other types of things, both behavioral needs of the community and some specialty services in the community that's needed as well. So it'll be a full service, really outpatient center that the community will be able to come to. And the other thing we're going to add to that is provide transportation. We're looking at Uber, and we're looking at other support transportation services for people that don't have access to transportation to get to the center. So we take people in for their appointment and take them home after their appointment. So it's a really exciting project for us, and we're looking forward to the build. It'll start this year and will end probably in sometime in early 2018. I think the advice I would give to my friends out there is focus on the patient, things that surround the patient, chronic disease, and how do you treat that better in the community. Hospital admissions are coming down. Outpatient growth is significant now. So you're going to be treating patients in a different venue, obviously, with less revenue. So, cost control, getting your delivery model up and running so the community has access to care is going to be very important. And that should be the focus in the next 5 to 10 years. Lower cost, higher service, higher access on the outpatient side of the marketplace is the future of healthcare.